All right, I'm here with Miss Lopez, and I'm going to interview her for a PA. The first question is, what is your current job title, and how long have you been in this role?
So I've been working as a physician assistant for a center called South Miami GOG. It's Gynecological Oncology Group. So we provide care for women with female cancers, so ovarian cancer, endometrial cancer, and cervical cancer. And I've been there for almost 10 months now. It'll be a year, January 25th.
How did you get this position?
So as a PA, your second year of schooling is clinical rotation. And I've always had an interest in oncology, so I picked my elective rotation to be in cancer, which happened to be this GYN cancer physician. And after I completed my rotation, he offered me a job once I graduated. So that's how I ended up there.
Okay. What do you enjoy the most about your job?
Interacting with the patients, the fact that these patients, you see them routinely because they need to come in for chemotherapy, they need to come in once they've completed treatment for routine follow-up appointments to make sure they fall into remission. So you build relationships with these patients, and you just enjoy seeing them on a monthly basis.
Do you work in a team or an independent environment?
So I would call it a team approach. It's 6 practitioners, 3 physicians, and then 3 first level. So it would be myself. I'm the only PA in the practice, but there's 2 other nurse practitioners, and then you have the 3 physicians, and we all kind of work together with the patient.
All right. And how does this impact your style of work, like working together, like as a team?
So there's always, I'd say, pros and cons in working with a team. As far as the pros is ideally we help each other out. The cons to it is sometimes is being the youngest one in the practice, the one with the least amount of experience. I find myself getting a lot more work dumped onto me because they just know she's young, she's inexperienced, she needs as much practice as she can get. So that's the downfall. But for the most part, we all work towards a common goal and making sure that the patient is either getting better or if they're just really receiving palliative care, that we provide the most comfort throughout that process.
What do you like the least about your job?
The least part that I don't like about my job is unfortunately dealing with oncology, which is cancer. There is no cure for it. So as much medicine, as much advancements that we have, unfortunately, it's not enough. So time and time again, I'm faced with patients that are dying, families that are suffering, and at times it can really take a toll on you.
What was your major in college?
So I got a bachelor's at FIU in health sciences. And then originally I wanted to do healthcare administration. So I got my master's in business administration at FIU. And then I decided to go into clinical acute care, and I decided to do PA.
All right, cool. And then can you just like briefly describe your career path to this current job?
So originally at some point when I was getting my bachelor's for health sciences, I ideally said I wanted to do medical school. And I always said that once I went through medical school, I'd want to do oncology. Reason being that through every, as far as I can remember, through every area in grade school, so like kindergarten, middle school, high school, college, I've always experienced someone that I care about who suffered from cancer. So I always felt passionate in volunteering in activities. Obviously, like I said, I ended up switching my career path several times from healthcare administration, went to PA, and once I decided with PA, I knew that besides just doing fundraising events in cancer, I wanted to make a career choice out of it, and that's how I chose oncology. GYN oncology wasn't the one that I think ideally I wanted to end up in, but it just so happened that that's who I did my elective with, and that's who pretty much offered my first job, and I felt like I couldn't say no. So that's how I am where I am today.
Perfect. Thank you so much.
You're welcome.